Hi, I'm Dr. Sreekanth Vemula. I'm a neurologist. Let's talk about headaches. Most of us, when we think of headaches, we think of migraine. But there are others too. Many people talk of tension headache. Tension headache is very common, but it is not seen by a doctor that much. You know why? Because it is preferable to have the headache than go and wait in a neurologist's office. It is much less painful than migraine. So what they have is a mild band-like sensation around the forehead, a tightening sensation which lasts for around half an hour and goes away on its own. It doesn't have any nausea, vomiting, intolerance to light, sounds, they don't vomit, none of this. It's a very simple thing, mild, so it goes away and so they don't bother. And it occurs very commonly and people just rest for a while, stop doing what they're doing, maybe have a cup of coffee or tea and talk with friends and it goes away. So it is called tension headache. It is not mental tension, that's what people think. It's not mental tension, it is muscular tension. So when I mention the topic of tension headache, they say, I'm not under tension, I'm fine. Yes, you're not under tension, it's not mental tension, it is muscular tension. So that is a common headache, but it is not painful enough to reach a neurologist. The one painful enough to reach a neurologist is migraine. Migraine is very common, especially in women. It affects almost 15 to 25% of the people. More in women than in men. It affects all age groups, but usually in the younger age group. Older age group also suffers, but not as much as the younger ones. What is migraine? Migraine is a headache which is named migraine because people assumed that it only affects one half of the head. Hemicrania, migrainea, migraine. So that's how the migraine came about. Hemicrania means half of the head. But we know now that it not only affects one half, it affects all of the head. It's a very intense headache. Pounding, throbbing, pulsating. People cannot tolerate it. They want to just hold their head, pound it and just lie down without doing anything. And before it happens, people feel an abnormal sensation, excessive hunger, but they cannot eat. They're feeling agitated, fidgety, not able to do anything. They want to relax. All these things happen and then sometimes they have a disturbance in the vision where they see flashes of light, zigzag lines going from one side to the other in a slow manner, not fast, very slow. It spreads like a zigzag line moving from outside to inside of the visual field. And after that subsides, it takes around 30 to 60 minutes to go away. After that subsides, then they have a pounding, severe headache that lasts for a long time. In children, it usually lasts for less than 2 hours. In adults, up to 4 to 72 hours. And that has nausea, vomiting, they don't want to do anything and they can't tolerate lights, sounds, all of these things happen. So you understand that they can't go to work, they can't study, they can't socialize, they don't go to parties, they prefer to stay at home. Imagine the stress placed on the people who are suffering from this. So for this, the ideal test is to just talk to the patient. There is no test that can confirm. Talking to the patient, finding out the symptoms confirms migraine. So that is migraine. Migraine, when it lasts longer than 3 days, it's called status migrainosus and it needs hospitalization and treatment. Migraine is treatable. Many drugs exist which treat migraine, not only abort the attack, but also to prevent further episodes. Your neurologist can discuss with you in detail about those options. Then there's a third headache called as cluster headache, extremely severe. Some people call it suicidally severe because they feel like jumping off when they have that headache, and some people have jumped off. It occurs in one half of the head only. It never occurs on two sides. It occurs as a severe painful condition around the eye. Intensely painful, they hold the eye, they cannot lie down. I told you the migraine people want to lie down. Cluster headache people don't want to lie down, they're very restless. If they are living in an apartment complex, they wake up in the middle of the night and they go around severely crying in pain. The whole apartment will know that these people have cluster headache and they have redness of the eye, watering from the eye, watering from the nose, swelling of one side of the face. Cluster headaches typically last less than 3 hours. If it lasts more than 3 hours, you need to think of other conditions. But even within those 3 hours, it is so painful that they cannot tolerate it. It is treatable too. The best treatment which works to decrease the attack of cluster headache is oxygen, 100% oxygen. When you place it, it gives immediate relief. There are other drugs too, and there are preventive medications too. Once you consult your doctor, they'll tell you how to decrease the cluster headaches. Then you have conditions called paroxysmal hemicrania. These are rare. Paroxysmal hemicranias are intense short bouts of headache which occur multiple times per day on one side of the head. That is also treatable. Apart from this, you have other headaches which are more dangerous, like when you have brain tumors or clots inside the brain or bleeding inside the brain or infections which cause inflammation of the meninges inside the brain. All of them can cause headaches. Those are rare but extremely dangerous, and you need to consult the doctor if you have fever, a headache which is not coming down, you are not able to function on one side of the body, you are not able to move the hand or leg or speak, or you have a fit. Any of these conditions should raise an alarm and you should consult your neurologist immediately. So when you have a headache, most of them are safe, harmless. They can be painful, but they are not dangerous. If you consult a neurologist, they'll tell you how to assess your headache, what type it is, what treatments are available, and how you can get rid of it. What can you do as a patient to not have these headaches? For example, migraine, sleep time is very important. 8 hours of sleep, eating on time, eating the right amount of food, exercising, and avoiding screens late in the night. All of this can help you apart from the medication that the doctor gives you. So you have plenty of options to live a pain-free life. Thank you so much for watching this. Please subscribe and follow us if you like this video.